Hi everyone, I'm Ashley, and today I will be presenting on the fentanyl epidemic in the United States. This paper and presentation was created for my AP seminar project. So within the general topic of the fentanyl epidemic in the US, I looked at three different subtopics: fentanyl, COVID-19, and solutions to the overarching problem. According to the United Nations World Drug Report of 2020, global drug use is rising. Between April 2020 and April 2021, drug overdose deaths in the United States have exceeded 100,000, higher than ever before. This graph from the National Institute on Drug Abuse shows national drug-involved overdose deaths. More importantly, it shows overdose deaths related to synthetic opioids, and it shows that they have increased exponentially in the past decade. As the fentanyl epidemic rages with no signs of stopping, the epidemic is an immediate and pressing issue. But before we dive any further, what is fentanyl? Fentanyl is an especially lethal opioid because of its high potency and faster rate of onset. Unlike other opioids, fentanyl can penetrate the brain in 10 minutes, 3 times faster than heroin. 1,000 micrograms of fentanyl, the weight of half a grain of rice, will cause near certain death. Unlike previous epidemics, the current fentanyl epidemic has spread throughout the United States and lasted for 6 years, compared to previous short, localized outbreaks. In addition, almost all fentanyl is imported from China or Mexico instead of being synthesized in labs within the United States. So fentanyl has been the driving force of the epidemic as drug dealers lace narcotic drugs with fentanyl. Fentanyl is most commonly laced in heroin in order to increase the effect of a high. Prior to COVID, the third wave of the opioid epidemic began because of the discovery of more efficient methods for synthesizing fentanyl and the rise of e-commerce behind the security of cryptocurrency. These methods allow easier access to drugs and lower chances of legal consequences. Going back a few slides, the 1-year period in which there were over 100,000 overdose deaths happened to be between 2020 and 2021. As we all know, these are the lost years, also known as the beginnings of the COVID-19 pandemic, when the world went into lockdown. COVID-19 has played an enormous role within the fentanyl epidemic as stressors arise and isolation increased, causing the demand for narcotic drugs to increase. During the COVID-19 pandemic, drug overdose death toll was higher than that of car crashes and gun fatalities combined. Proposed causes for the exacerbation of the death toll are additional stressors, supply chain issues, and the lack of access to treatment. First off, an issue would be the supply chain, which has caused increased shipping costs and affecting the drug market through increased manufacturing costs and shipping delays. Since shipping costs have risen, supplying a more potent drug, that is fentanyl, helps meet demand in a cheaper and more efficient manner. Secondly, the worsening of the opioid epidemic could be due to the closure and lack of access to treatment. The closure and restrictions for non-emergency medical services and increased stressors have left many without the proper support to avoid relapse. Despite heavy accusations of the epidemic toward the pandemic, experts still believe that the opioid epidemic would have gotten worse last year without a pandemic. Before the pandemic, synthetic opioids deaths were trending upward, with no signs of stopping, with or without a global pandemic. Since drug use and overdose deaths are rising, the safety of drug users are increasingly important. Various solutions have been proposed to minimize the death toll, but today I will be focusing on two: reversal medication and public education. The first solution is reversal medication. Reversal medication is medication designed specifically to help reverse drug overdose. An example of a reversal medication would be naloxone. Naloxone is a medication designed to reverse opioid overdose, including fentanyl overdoses. It helps victims restore normal breathing and return to homeostasis. A recent study estimated that broader community uptake of naloxone could prevent 21,000 deaths over a 10-year period, more than restriction on prescription opioids or expanding medications for addiction treatment. Some limitations of naloxone include inaccessibility and education. Firstly, reversal medications are costly, making it so families may not be able to pay for the needed medication. According to this chart, the lowest average cost for one dose of naloxone is $15.83. In addition, the cheapest option is an intramuscular self-assembly medication. This requires bystanders to be educated on the different types of administration and be comfortable in administering the drug. Secondly, reversal medications are only available in pharmacies and hospitals. People living in rural areas may not have access to such facilities and thus are unable to obtain reversal medication. Another solution is public education. Public awareness plays an integral role in solving the drug crisis as a prevention and rescue strategy. In order to achieve public awareness, accessible drug education is needed. Public education is both a prevention and rescue strategy because it can advocate for the dangers of drug use and help reduce mortality by training individuals to spot signs of overdose or how to use reversal medication. According to a study conducted by O'Donnell and colleagues, common barriers for bystanders providing no response include spatial separation, lack of awareness of drug use, and inability to recognize a drug overdose. Educating the public on spotting signs of drug use and overdose can increase the rate in which bystanders assist the overdose victim seek medical help, reducing the death toll. Although public education is a viable strategy in curtailing the drug crisis, it has its limitations, and these include resources, community engagement, and time. Public education requires resources such as funding for educators, supplies, and location. Since public education requires many resources, communities without such resources may not have access to such education. This could result in the further widening of the health equity gap between communities of different socioeconomic backgrounds. In addition, it is hard to determine the impact of public education as it requires community engagement. Drug services have long been stigmatized in drug-ridden communities, and this stigma may make it so drug education does not reach the people who need it most. Finally, public education takes time, meaning it is not an immediate solution to the urgent drug crisis. Bringing together public education and reversal medication leads to a viable solution of implementing a drug safety program. Public drug education can be centered on drug awareness and safety, including the use of reversal medications. All in all, both of these solutions complement each other as increased public awareness causes a wider uptake of reversal medication, reducing the death toll. So thank you for listening to my presentation. I hope you learned more about the fentanyl epidemic, and my contact information is here.
Thank you so much, Ashley. That was such a great presentation on the fentanyl epidemic. I wanted to open up the floor to see if anyone has questions for Ashley.
Hi, Ashley. Thanks for the presentation. It was very well articulated. We definitely got the urgency of the problem from your presentation. Do you think, how long do you think this will take, this education plus reversal? Because I assume that both of the techniques you told are in practice now. I don't know how well established that the medications are available and the education is rolling out. but it needs to be better delivered, I guess. How do you think it can be worked out better, and how long do you think it will take to possibly solve this issue?
So reversal medications are already like pretty widely used. You can get them in most places that the fentanyl epidemic is like raging, because governments have really pushed to get that accessible to everyone, but price is still an issue, and some other accessibility issues are like pharmacies and hospitals, that sort of thing. But they're really trying. It's way easier to get naloxone now than it was like 10 or 5 years before, because there used to be a lot of limitations on who can purchase it. And also education. It's not really a really well-developed strategy right now. So there are places that are trying this program, but they haven't really had that much to say about it, because it has like really just started, and obviously COVID kind of slowed that down with everything moving online. So I think it's gonna be a while until the epidemic stops, but I'm hoping that once COVID is dying down and people are like more back into their social lives, have more to do, and like the economic situation gets better, hopefully that will stop. Yeah. Thank you for your question.
Thanks for the answer. Yeah, I definitely agree. The pandemic and the economic situation might be one of the important factors for this as well. So when it dies down, it might help it get better, and the solutions you are proposing might even work better. Both of them might go well in together. Yeah, great presentation. Thank you.
Thank you so much. And is there anyone else who has a question for Ashley? I actually do have a question as well. Ashley, I was wondering in your research if you ever ran into any data on the sort of income sort of circles or brackets that the fentanyl epidemic is mostly affecting in the US?
So due to the pandemic, like a lot of income situations have changed, but prior to the pandemic, it was usually like middle class white males. So I think it's middle class white males, because the middle class can like really afford drugs, and most of the people who have died are recreational users. So you have to have some sort of disposable income to be able to afford the drugs in the first place. So like low to middle income was like a big, and also like people living in suburban areas, and sometimes whole neighborhoods would have like 10 or 15 people who died from the fentanyl epidemic because they were all taking drugs together. Yeah.
That's very interesting. Yeah, I'm sure the pandemic also just changed the entire way that that those kinds of things were distributed. Yeah, that's really interesting. Is there anyone else who has a question in the group, or else I'm going to ask one more? Okay, cool. So we actually had a commentator sort of look through your presentation and wrote a question for us. So I'm just going to read that one out. So it says, this is a question that is a bit from the left field. Economists sometimes use the term diseases of despair to describe medical conditions that increase in groups of people who experience despair due to prolonged exposure to harsh social and economic conditions. A main category here being drug overdoses. One worry about your solution in light of these deeper structural issues is that they merely treat the symptom, whereas the root causes are actually the systemic socio-economic problems. Do you have any thoughts on this?
So I don't think it's fully because of socioeconomic problems, because most of the time when you do narcotic drugs recreationally, they don't kill you. But fentanyl has kind of taken the United States by storm because it's like cheaper and more potent, and it's also all imported. So the government really has to do a better job of stepping in and like regulating the situation. Like socioeconomic factors are only going to make you do drugs, and most people who have died are not really seeking to take this super potent drug that has a really high chance of killing yourself. So the underlying factors are an issue, but those issues are really big, and if they could be solved, they would have already been solved. But right now we're just focusing on one thing, and how to reduce the death toll. So yeah.